Staffing shortages, reimbursement challenges, and compliance crackdowns aren't a distant threat. They're coming. The real question is, will you be ready? That's a wake-up call for every clinical lab leader facing today's mounting operational pressures. I'm Megan O'Sullivan, and my guest today is Jon Harol, founder of Lighthouse Lab Services, one of the leading providers of clinical lab consulting, staffing, and operational solutions. From building and licensing labs to meeting staffing demands and securing payer contracts, Jon and his team specialize in helping labs prepare for the future. And here with us today is Jon Harol, founder of Lighthouse Lab Services. Jon, welcome to Life Sciences Decoded.
Thanks for having me.
Preparedness for clinical labs. In the opening quote, you've said that the biggest threat to labs aren't distant, they're here now. Staffing shortages, reimbursement challenges, compliance crackdowns. Why is preparedness such an important thing to address for clinical labs today?
Sure. Yeah, I think we're seeing a critical moment for clinical laboratories. I'm not even hearing people talk about it, but we mine the CLIA and CMS databases of active CLIA applications to see how labs are doing, and we chart that. And over 40% of independent labs have gone out of business since 2022. It's just decimated the industry, and no one's really talking about it. And most of the time, those reasons are a lack of preparedness or trying to do things in an old way. And we're just seeing that the old paradigm is really not working. You need to be thinking on a future state about how you're going to survive. And the herd has been thinned. That can be good news, right? There's opportunity out there. Sample volume has to go somewhere. So we're seeing consolidation. We're seeing some labs grow, and labs that are doing it right are growing.
And how does Lighthouse help labs stay ahead of the curve?
Sure. We try to be a kind of multi-stop shop for lab owners, and we started as a recruiting staffing firm as a response to the medical laboratory staffing shortage back in 2003. So we just passed our 22nd year a few days ago in business, and we've added service lines consistently, always at the request of client need, right? And so we started providing the staff, and they asked us, can you also provide lab directors? Can you provide the lab directors on a part-time basis? We now provide lab directors to about 200 CLIA labs, high complexity CLIA labs around the country every day. We started asking for, clients asked for help with validations for LDTs. So we brought on a team of PhDs that help with that, with lab setup, with design. And then we purchased and acquired a revenue cycle management company to help with reimbursement challenges. We recently purchased a field service engineering team to service equipment, so you don't have to pay OEM prices all the time. So we've always been just trying to figure out what's the need, market access, getting in network with payers has been a challenge. So we acquired a company that specializes in that. And we just consistently grow through trying to listen to the customer voice.
Your wage and morale report shows labs are still struggling with understaffing and burnout. What are some of the strategies you're coaching your clients on to attract, retain, and support qualified lab technicians and professionals?
Yes, I think that the labs that do it well play a long game, right? So they invest in their current employees, which is your best strategy for not having consistent openings and a rotating door. And so the labs that invest in culture, I think good lab culture attracts talent and it retains talent. And I think too often lab managers are stuck in a fire drill where they're, let's hire a temp, we got a Band-Aid and bubblegum patch this need, and they're never really investing in the team in a way that's going to grow things long term. So I would encourage lab managers to think long term. Still need for help sometimes to find that talent. We're here to help with that and make sure that we're making good matches. But I think investing in team morale and culture is like one of the number one things that's within the control of a lab manager to improve the situation over time.
And I would imagine that fills a little bit of the gap between where labs are with wages and being able to keep up with the cost of living.
Sure. I think flexibility is this next generation of lab workers' top priority, higher than salary. They want to know, can I work from home one day a week? And that idea to maybe a seasoned lab manager that's been doing this for 30 or 40 years sounds absurd. Like, can you work in the lab from home? But I've seen it successfully done. There's QC, composite. There's so many different paperwork type things that need to be done that you can give your staff one or half day every 2 weeks or whatever to work from home. There's things that can be done, and it goes a long way with the team when you're able to provide a little bit of work-life balance and flexibility in that way. And I think it builds that culture and morale that keeps them around.
So, building resilient labs is one of your missions. So, between what's going on now with CLIA, the tighter CLIA oversight, constant reimbursement pressure, many labs feel they're always behind the eight ball. How do you help your clients turn compliance and revenue cycle management into a strength rather than a vulnerability?
Right. I think it is important to know that when you strategically attack these things and do it well, over time, again, it's going to allow you to distance yourself from your competitors and the other labs doing it. And the labs that we've seen survive have done that well. So they've paid attention to how do we make sure that the sample volume that we're going after and bringing in the door is something we're going to get paid to do. That's a afterthought for many labs. I would say probably 40% of sample volume in most independent labs is unpaid. So it's free work that they're doing. And the name of the game for their sales team is go out, get samples in the door. You need to be strategic about how you go about getting samples. Are they the type of samples you're going to get paid for? And then on the compliance side as well, making sure that you're doing a good quality job, taking the time to think through workflows and how you do things, not only to check a box, but because your lab's going to operate more efficiently. The reason a lot of these standards are in place are because they're in your own best interest, right? Making sure that you're checking every label on the front end and you're getting the correct sample. All of those things serve a purpose. And when you skip those or cut corners, you end up wasting time. Haste makes waste. And so we really encourage labs to just make sure they have the right team in there. There's a crackdown right now among CLIA inspectors to make sure that the paperwork around the lab worker has been authenticated. It's been an honor system so far. And now they're saying, no, we want to know that the people doing the work in your lab are actually qualified to do that. And we got a lot of angry responses when we've shined a light on that issue. And I feel like, well, that doesn't come from a good place. We should all want to make sure that everybody's qualified. Yes, it's a little bit of paperwork and bureaucracy, but I think in the long run, we're going to end up stronger because of it.
So let's get to a mythbuster question. What's one of the biggest myths about clinical labs that you would like to bust, and what's the reality people miss about them?
Sure. I think I can think of a couple. One of them is the LDT perceived issue in the public, right? There's no data that we've seen to support that lab developed tests are driving bad results. The system we have with medical directors on site overseeing clinical validations of lab developed tests so that laboratories can customize testing for their needs, I think is good. There's a lot of checks and balances in it. And we have groups, society groups, Friends of Cancer. There's other groups that have this perceived idea that non-FDA approved means Wild West. And when you look at the top 20 tests that have the most errors, they're all FDA approved tests, right? And so this idea, when we talk about Theranos, all run on FDA equipment. And so people point at LDT as being the issue, where I think the issue is, just making sure that you have good quality testing and standards are followed, and those checks and balances are there for a reason. And I think they work. And we haven't seen data saying lab developed tests are producing erroneous results. And so before we kind of throw baby out with bathwater, I think we should really look at that and say, let's make sure that we're thinking about this in the most logical way. And maybe the way that we have the best impact is trying to modernize CLIA, which was written in 1988, was the last time that it's been adjusted. And now we have AI algorithms producing lab results. We have digital samples being sent between laboratories, and none of this is contemplated in the regulations. Like, these are the things we should be focusing on to make sure that we have impact and have good quality testing for the public.
There are a lot of patients who want those lab developed tests.
Yes.
So let's talk about the future of clinical labs. From automation to consolidation, the lab industry is changing fast. Where do you see the biggest opportunities for labs to adapt, moving and thriving into 2026? And how does Lighthouse play a role in that?
Sure. I think some of the bigger changes might be even happening outside of just the lab. It might be a health system change. We see this movement from fee for service to value-based care. Value-based care wants to compensate for results. And that means that we need to have a focus on preventative care. We see this MAHA movement also saying preventative care is what's going to be important in the future. So, how does the laboratory play a role in preventing big negative outcomes from happening on the back end by detecting them on the front end? I think we're in the best position to do that. And I think we are the best dollar you can spend inside of healthcare. And I think that's like a hidden secret almost. Like there's not a wide knowledge of the fact that the laboratory is responsible for 2.6% of healthcare spend and produces 70% of the medical decisions are based on that data. We're the best dollar you can spend to get the information you need to make good medical decisions. In the labs that think of positioning themselves as a partner in value-based care are going to do really well.
Thank you so much for being on Life Sciences Decoded. Those were great insights into the clinical lab, and I think people are going to learn a lot. So thank you for joining us.
Thanks for having me, Megan.